This is the lecture for Chapter 4, Diseases and Conditions of the Endocrine System. And what you should see on your screen right now is a picture of the major endocrine glands and their location within the body. My hopes are that through a terminology class or anatomy class, you have become familiar with these glands and the hormones that they produce. There's really good information at the beginning of this chapter about the orderly function of the endocrine system, and Table 4-1 provides a listing of the major endocrine glands, the hormones, and the target action. And you should know that information before you go into the study of the abnormal, because it's really important to understand the normal before you start looking at what can go wrong. And when we talk about what can go wrong with this system, it's all about the level of hormones secreted in the body. Endocrine disease is either a problem from excess secretion, which is hypersecretion. Hyper means too much, or high, excessive. Or the endocrine disease is a problem with hyposecretion, which is not enough secretion, reduced secretion from the gland. So it's very important to know the difference between hyper and hypo. When you read about each of these conditions, the way the physician is going to diagnose most of these conditions will be certainly based on the clinical signs and symptoms, the complaint that the patient has, the way the patient looks when the patient comes into the office or the hospital, depending on whether it's an emergency or not. But the most reliable diagnosis of the endocrine system disorders would be through the use of measuring blood serum levels of these hormones. Occasionally they'll use the urine to measure hormone release in the urine, but mostly we're looking at blood serum levels of these specific hormones. I'm going to cover every condition of the endocrine system described in your textbook. Starting with the pituitary gland hormones, I'm going to talk a little bit about the normal production from each of these glands and the normal hormones and what they produce. So again, starting here with the pituitary gland, which is referred to as the master endocrine gland. It's referred to as the master endocrine gland because this gland is responsible for the production of hormones from other glands in the body, like the thyroid stimulating hormone that's responsible for stimulating the thyroid to produce the hormones, and the adrenocorticotropic, the adrenocorticotropic hormone, which is abbreviated ACTH, is very important for the proper functioning of the adrenal glands. It's a pituitary that stimulates the adrenal to produce their hormones. And I say their hormones because there's two adrenal glands. And then the gonadotropic hormones. The pituitary gland produces hormones that will stimulate the gonads, the ovaries and the testicles, to produce their secretions. Also produced from the pituitary gland is the growth hormone that causes growth within the body. This is especially important before puberty to allow a person to grow to a normal size, and also after puberty to allow a person to regenerate or repair tissues that have been damaged. And then prolactin. Prolactin is a hormone that will stimulate breast development and formation of milk during pregnancy and after delivery. Oxytocin also helps with this as far as the secretion of the milk, and oxytocin is best known for the stimulation of the uterus, the uterine contractions when a person is delivering, a person's in labor. The melanocyte stimulating hormone MSH does what its name says. It stimulates melanocytes to produce skin pigmentation. An antidiuretic hormone, abbreviated ADH. Antidiuretic if you look at the word just diuretic, a diuretic causes you to lose water. Like caffeine, these caffeinated drinks that you might drink are diuretics. They cause the loss of water from the body. Antidiuretic does just opposite. Antidiuretic hormone will cause you to actually hold water in the body. And that's very important, because if you had too much of the antidiuretic hormone, the person's going to have swelling. They're going to be retaining too much water. If they don't have enough, then they're going to become dehydrated because of the diuretic effect, because they're going to lose water. So this is antidiuretic. Now, all of these abbreviations are important. Anytime you see abbreviations on your PowerPoint slides during my lecture, you know those abbreviations are important. Important for test information, important just to understand and be able to communicate in the medical language. As far as disorders of the pituitary gland, looking first at the hyperpituitarism, which refers to an increase or an oversecretion of the production of the pituitary hormones. The effect is particularly seen when the growth hormone is overproduced. The treatment of any hyperpituitarism is going to be aimed at decreasing the amount of growth hormone, or actually decreasing the amount of all these pituitary hormones being produced. And that's usually accomplished by surgery, removing part of the gland, or by radiation destroying part of the gland. Two of the hyperpituitarism conditions to learn about, starting with gigantism, an abnormal pattern of growth and stature. The gigantism occurs when too much pituitary growth hormone is produced before puberty. The person is growing and they just keep on growing. It's an overgrowth of all the body tissues. Hence the name gigantism. And you can see a really good diagram in your book of the effect of the growth hormone. The very tallest person there has gigantism. And then you see the normal height. And then you see someone who is a dwarf. There's a lot of different types of dwarfism, but one type is hypopituitarism. And I'll come to that in just a minute. I want to talk first about the other form of hyperpituitarism that actually occurs because of overproduction of pituitary hormones after puberty. And you see the picture of this person here. Acro means extremities, megaly means enlargement. There's enlargement of the hands, the feet, even the facial features. There's overgrowth of bones of the soft tissue in the face. So that's hyperpituitarism with gigantism, increase or overproduction of pituitary hormones before puberty, acromegaly, overproduction of these hormones from pituitary after puberty. And the treatment is just to try to reduce the amount of growth hormone either by radiation or surgery. Okay, at the other end of the scale we see hypopituitarism, which is a decrease in the amount of pituitary hormones, absence or deficiency of pituitary hormones. Now, there's going to be a number of different signs and symptoms that the person's going to have because of hypopituitarism. Everything from metabolic dysfunction, which would be from the hypoproduction of the thyroid stimulating hormone, the hypoproduction of the adrenocorticotropic, and still having troubles with that, the adrenocorticotropic hormone, underproduction there, the sexual immaturity because of the underproduction of the gonadotropic hormones, growth retardation because of the underproduction of the growth hormones. Of course, the hormones levels, like I've said before, hormone levels can be measured in a sample of blood, or in this case in a sample of plasma. The treatment depends on the age of the patient. Also depends on the severity of hypopituitarism and the type of deficiency. Sometimes even an underlying cause can be identified, and you treat the underlying cause, and the hypopituitarism would be corrected. Replacement therapy is going to be needed. Replacement of all of these hormones is a difficult situation. You can replace the hormones, but monitoring the level of the hormones is so important. and it is so difficult to achieve just the right level of the production or just the right level of the supplements that the person is going to have to take. Okay, another form of hypopituitarism is the hypopituitarism dwarfism that occurs in children because of the hyposecretion of the pituitary hormones, especially growth hormone. There's extreme growth retardation. Now there is also, in many cases, some degree of mental retardation present also. Not only is the child extremely short, the body's very small in proportion, but they do not develop secondary sex characteristics. Again, there's many different forms of dwarfism. This is just a particular form. Now, supplemental growth hormones can be prescribed. There's hormone supplements that are definitely going to be needed here, and the results of the treatment will depend on how early the person begins receiving the replacement therapy and exactly what's causing this hypopituitarism. Okay, also under pituitary disease is a certain form of diabetes. Now, what you may be accustomed to hearing about when someone talks about diabetes would be diabetes mellitus, that has everything to do with blood sugars. And I will be talking about diabetes mellitus in a few minutes as I describe problems with insulin. But this is diabetes insipidus, which is a deficiency of antidiuretic hormone. That hormone is also called vasopressin. Okay, if you think about what the hormone does, antidiuretic, it helps you keep water in your body. So if you have a deficiency of the antidiuretic hormone, you're going to have excessive polyuria, excessive urination, polyuria. And because you're losing so much water going to the bathroom so often, you should also have polydipsia, which is excessive thirst. Eventually, you'll start having signs of dehydration because of the loss of fluid, fatigue. Treatment is going to be with the vasopressin, with a replacement of the hormone here, the antidiuretic hormone. Oops, I changed the screen too soon. I'm sorry about that. Okay, under diabetes insipidus, I wanted you to see under diagnosis that if a patient goes to the doctor and complains about excessive urination and excessive thirst, really those are the signs also of diabetes mellitus, and that'll be the first thing that the doctor investigates. And most likely it would be diabetes mellitus instead of the insipidus, because insipidus is actually a pretty rare condition. But again, if they have polydipsia, polyuria, and they have some signs of dehydration, the clinician should be thinking about performing what's called a specific gravity test on the urine. Specific gravity is a comparison of the density of urine with the density of water. And a low specific gravity suggests diabetes insipidus because there's so much water present in the urine. Now, there are other tests that will be performed to confirm the diagnosis of diabetes insipidus, but that's kind of the starting place. With the starting place for polyuria, polydipsia is to decide if it's diabetes mellitus or not. If they find it's not diabetes mellitus, then the further study needs to be done to determine if it's diabetes insipidus, which would be the test of the urine-specific gravity. Treatment can be given in the form of the vasopressin injections or a nasal spray, or there's also oral medications that can be taken. Again, that's a pretty rare condition. Okay, looking at thyroid hormones now, and the position of the thyroid gland is in the neck area. It kind of surrounds the trachea. There are 3 hormones, main hormones produced from the thyroid gland, T3, T4, and calcitonin. T3 and T4 control metabolism. Metabolism refers to the chemical processes going on in the body. Maybe you've heard of someone before that talked about or referred to somebody as having a fast metabolism. A fast metabolism literally causes a person to digest their foods faster, and they'll move faster. They don't seem to gain weight, even though they may eat a lot. A person with a fast metabolism may very well have a problem with the thyroid hormones. And then there's calcitonin, which stimulates calcium to leave the blood and enter the bones. Calcitonin lowers blood calcium level. When you take in foods that are full of calcium, any food that has calcium in it, like the dairy products, the milk, or even calcium supplements, you've also going to have vitamin D with those, with the calcium that you take in, and you absorb the calcium through the digestive system and into the bloodstream. And then you have to have calcitonin that will cause the blood to, that will cause the calcium to enter the bones. Calcitonin produced from the thyroid causes calcium to leave the bloodstream and enter the bones. It lowers the blood calcium level. Okay, so those are the hormones. Now when we look at the abnormal conditions have everything to do with too much or not enough production of these hormones. And keep in mind that when we talk about the thyroid and the thyroid gland production, the thyroid is being controlled by the pituitary gland through the production of the thyroid stimulating hormone. So if studies were going to be done of the thyroid hormones, studies would also be performed to see if there was enough thyroid stimulating hormone being produced from the pituitary. Okay, first condition to look at here, this is a goiter, and truly there's not a lot of people that would allow the goiter to grow this large before they receive treatment, but it could grow this large, and when the goiter grows to this kind of size, it's going to cause the person difficulty with breathing, the dyspnea, even difficulty swallowing, maybe even dizziness and syncope because of the pressure on the carotid arteries that are located inside the neck. It's actually more common that the person would have a goiter about the size of the picture that you see in the book. And, at that point the person should realize, oh my goodness, something's wrong here, and should seek medical treatment. A goiter is described as being enlargement of the thyroid. Two causes listed here: inadequate iodine in the diet, or the sign of a more serious condition, which would be a condition of having hypothyroidism, or even hyperthyroidism can cause goiter formation. The inadequate iodine, you have to have iodine in your diet for your thyroid to function properly. And there are areas in the world that have a deficiency of iodine. They don't have the iodized salt like we have. And it's like all of those people in that area that have the inadequate supply of iodine in the diet have the goiter formation. So there's certain geographic regions that are more likely to have goiter formation due to the low levels of iodine. But what I'm talking more about here in this chapter and teaching in this pathology class is about the type of goiter that's produced because of thyroid problems. Diagnosis again made by examination of the neck, and then the blood studies will be performed to determine if there are elevated or reduced levels of T3 and T4. Treatment, the early stages of the treatment, the patient will start receiving potassium iodide to help as far as if there was some form of iodine deficiency. Then investigation to find out what is going on with the thyroid. Does the person need thyroid supplement? or does the person really have hyperthyroidism? Okay, this is one of the causes of a person to have a goiter, and it's called Hashimoto's chronic thyroiditis. You know, itis, there's inflammation of the thyroid. It's chronic. It lasts for a long period of time. Goiter formation is common. It's probably the most obvious of the symptoms. Do I call it a symptom? Yeah, the patient may say, I have this big thing on my neck. It's also a sign because we can observe this enlargement of the neck area. This is an autoimmune disease. The person's immune system is actually producing antibodies that destroy the thyroid tissue. Hashimoto's thyroiditis occurs more often in women, and when it does occur, it's more likely to be in the age group from 45 to 65. The goiter formation and hypothyroidism, or symptoms of hypothyroidism, are obvious. Symptoms being an increased sensitivity to cold, weight gain, mental and emotional problems, mental apathy. The belief is that Hashimoto's thyroiditis is actually caused by a genetic defect. Treatment's going to be the thyroid hormone replacement, and that hormone replacement usually prevents further growth of the goiter also. It is important in some cases to have a biopsy of the goiter to be sure about the diagnosis. But what the person has here, they have a deterioration of the thyroid because of the antibodies that destroy the thyroid. And while it's deteriorating in tissue, it actually is inflamed and this goiter forms. But again, treatment is possible, and treatment is usually successful with the thyroid replacement therapy. Okay, Graves' disease. And the first thing I have pictured on the slide and what you see in the book is a picture of someone that has exophthalmos. Their eyes bulge, literally their eyes protrude outward. Graves' disease is an overproduction of thyroid hormone, which causes enlargement of the thyroid and other symptoms such as exophthalmos and heat intolerance. The person, instead of being cold all the time, they're hot all the time with Graves' disease. They have an increased metabolism, which means usually that they're going to be able to digest food faster, they'll eat more food, and they'll have the excessive appetite, but with weight loss instead of weight gain. This is hyperthyroidism. This is increase in thyroid hormones. So the signs and symptoms that you see here have everything to do with increased release of T3 and T4 thyroid hormones. Treatment involves anti-thyroid drugs. There are drugs that will counteract the action of the T3 and T4. There are drugs that will block thyroid hormone synthesis. Now the person may also need symptomatic treatment of the tachycardia, the fast heart rate, and the hypertension with drugs like beta blockers like tenormin. In some cases, the person may actually have surgery to remove the thyroid or remove part of the thyroid. The person will also have anxiety, so they may need some medications to help them deal with the anxiety that goes along with the physical problems of Graves' disease. Okay, this next condition is hypothyroidism. Okay, this is a decrease in thyroid production in an infant. This is called cretinism. It's a congenital condition. It's something that the person is born with. It's a problem with fetal development. The person may actually have just a complete absence of the T3 and T4 hormones. or it may be just an extreme deficiency. With this type of dwarfism, the person is going to have both mental and growth retardation. But if the condition is diagnosed early enough, it can be reversible. It can be reversed. It's so important to take babies in for the well baby checks and the measurements and the weight measurements and the height measurements to determine if the baby's growing properly, because if not, then it could be a condition like cretinism, that if the person the baby receives thyroid hormone replacement, they can then grow normally. And that blood test again can be done to show the levels of the thyroid hormones. So cretinism is hypothyroidism in an infant, congenital condition, versus myxedema, which is hypothyroidism in an adult. And the myxedema is actually a sign of someone that has hypothyroidism. Usually affects females again. The face becomes bloated, the tongue becomes thick, eyelids are puffy. The female may also have menorrhagia, excessive menstruation, bleeding, muscular weakness, fatigue, weight gain, loss of hair, constipation, intolerance to cold, slow speech. All of these are common signs and symptoms of having decreased thyroid hormone production. So fortunately there is treatment, and the response to treatment is usually good, and the treatment would be hormone replacement therapy. And I've actually listed the name of one of the drugs here commonly used is Synthroid. Synthroid is the common brand name. Okay, next condition of the thyroid is thyroid cancer. If a person develops thyroid cancer, it's going to be a carcinoma. And thyroid cancer can cause either hyper or hypothyroidism. It can actually cause either one. It can cause the person to produce too much or not enough of the thyroid hormones. And then the treatment is going to be removal of the thyroid gland, either by surgical removal or by radiation destruction, irradiation. And then after the thyroid is destroyed or removed, then the person needs a lifetime replacement of the thyroid hormones with a drug like Synthroid. Okay, next we're going to look at the parathyroid glands. Parathyroid, these glands are located on the back of the thyroid. They are 4 tiny glands kind of embedded in the back of the thyroid. The main hormone produced here is abbreviated PTH. It's parathyroid hormone. The parathyroid hormone causes calcium to be released from the bones into the bloodstream. Increases blood calcium level. I talked a few minutes ago about calcitonin, and it works just opposite than the parathyroid. The parathyroid hormone, when you need calcium released into the bloodstream, will cause that release. Now, most people know about how important calcium is for the bones and how important it is to make the bones and teeth strong and hard, but you may not realize how important calcium is for the nervous system. That if you don't have the appropriate amount of calcium in the bloodstream, then the nervous system is not going to work properly. The nervous impulses are not going to be carried along the nerves appropriately. So when we eat calcium, we don't really eat calcium. I guess what I do, I take supplements. But when you eat food that has calcium and vitamin D, that calcium is absorbed into the digestive system, and then it's absorbed out of the digestive system into the bloodstream. And then it's calcitonin that will decrease the blood calcium level by sending the calcium to the bones. And then it's the parathyroid hormone that will then cause calcium to be released back into the bloodstream so that the blood calcium level is hopefully kept level at all times for the nervous system to work properly. So parathyroid hormone increases blood calcium level. So the problems that a person has are due to either increased secretion or decreased secretion of parathyroid. So this is hyperparathyroidism, increased secretion. Okay, to understand what happens when there is too much parathyroid, you've got to understand just the normal. Parathyroid will cause the calcium level to increase in the bloodstream. So when the person has hyperparathyroidism, they release too much calcium into the bloodstream. Therefore, they have hypercalcemia. And with hypercalcemia, the person will have problems with their nervous system and their muscles. They'll have muscle weakness and atrophy. They'll have gastrointestinal pain, nausea, vomiting, even cardiac arrhythmias because the nervous system's not working properly. Also, because there's too much calcium in the bloodstream, the person ends up having kidney stones. These calcium deposits in the walls of the blood vessels. Now, as a person develops the hypercalcemia, because hyperparathyroidism, their bones are also going to be decalcified because too much calcium is leaving the bones. The bones become weak due to decalcification. They tend to break, bend, and become deformed. Treatment of hyperparathyroidism depends on the cause. It could be that the person has an adenoma. It could be that they have a tumor of the parathyroid gland. And then the person would have to have surgery. There's a number of different underlying causes of hyperparathyroidism, and signs and symptoms are caused by hypercalcemia, too much calcium in the bloodstream, and the problem with the bones become weakened. Now, on the other hand, there's hypoparathyroidism. Not enough production of parathyroid hormone. So if the parathyroid hormone causes calcium to leave the bones and enter the bloodstream, if you don't have enough of the parathyroid hormone, you'll have hypocalcemia, not enough calcium in the bloodstream. When you don't have enough calcium in the bloodstream, you're going to have some really serious nervous system problems with overstimulation of skeletal muscles, which will result in spasms. I know a person who once had hypocalcemia, and the first complaints were that her toes and her fingers were numb, and she had tingling of her toes, and she thought, well, she'd just been on her feet too long and just kind of exhausted. And when she got home from work that night, she started having what she called Charlie horse in her leg, the muscle spasms, the cramps of her legs. Well, one leg was cramping, and then the second leg was cramping. And she knew something pretty serious was going on because both of those legs were cramping, and they wouldn't let up. And then her neck began to have a spasm. The muscles of her neck caused her head to be pulled downward. And then she realized, oh my gosh, something's really bad wrong here. And she went to the emergency room, and fortunately the emergency room physician immediately recognized the hypocalcemia and got some calcium into her body. Now, her hypocalcemia wasn't really due to hypoparathyroidism. It was due to an antibiotic that she was taking that was taking the calcium out of her body. There are some antibiotics that will take the calcium out, so the person's supposed to drink milk with them or take calcium supplements. So that's just an example of signs and symptoms of hypocalcemia, and it's just so important that if the person isn't treated early, when it's just a matter of spasms and numbness and tingling, they may go on to have laryngospasms where they can't breathe, or life-threatening arrhythmias, the abnormal heart beating or heart rhythm. May have respiratory paralysis and even death because of hypocalcemia resulting from the hypoparathyroidism. The treatment is to replace the calcium and vitamin D. Vitamin D is absolutely necessary for calcium to be absorbed out of the digestive tract. And the person's going to have that lifelong calcium replacement. They'll be on a high calcium diet forever. Okay, the next condition to look at, or the next system, will be the adrenal glands. And I'm going to end part 1 here, and then I'll pick up with adrenal hormones in part 2.